So my name is Emily and this is my lovely assistant Steven, and we're going to be testing two cranial nerves. We're going to be doing the glossopharyngeal with the gag reflex and the vagus with the motor, just making sure he can elevate his mouth properly. So the first one, we're going to go ahead and have him open his mouth. Okay, I don't know if you heard that, but he definitely gagged, unfortunately. So, but I mean, that's good. It means the reflex is there. And then I'm going to go ahead and examine him. I'm going to say, go ahead and open your mouth and say, ah. A little wider. Ah. Good, okay? So that's a normal response because he's able to elevate his mouth. So both cranial nerves, glossopharyngeal and vagus, are intact. Okay, so now that I'm going to just go off of what the sensory motor and autonomic responses are of the vagus and glossopharyngeal central cranial nerves. So they both have all three. The glossopharyngeal is a somatosensation from the soft palate, pharynx, middle ear, and posterior third of the tongue. For motor-wise, it's the pharyngeal muscles, the parotoid, and the salivatory glands. And for autonomic, it's going to signal the carotid artery and also have play in the gag reflex. For the vagus, cranial nerve 10, sensation from the pharynx, the meninges, and a small region of the auditory meatus. For motor, it's going to be the pharyngeal muscles, swallowing, larynx muscles, and voice box. And for autonomic, it's going to be your heart, lungs, digestive tract for the gag reflex. Then there are quite a few nuclei for both of these nerves, but they're all going to be in the medulla. So there's 4 for each one, which this schematic is actually kind of really nice. So first we have the nucleus ambiguous, which is going to be this one right here, the red one, and it's going to go to the pharynx. And then there's the spinal nucleus, the blue one, which goes to your, which is sensation of the tongue and middle ear, then the soft palate. It's the trigeminal nerve there, the spinal nucleus. The solitary nucleus is going to be the green representation there, and it's going to be the third of the tongue, and the salivatory nucleus is going to be your right here, your glands for swallowing. Then for vagus, it also has 4 nuclei, and the dorsal motor nucleus is going to be here, and it's actually not a motor, it's part of the parasympathetic nervous system. The solitary nucleus is going to be here, and it's going to go to the taste and epiglottis. The nucleus ambiguous, which is going to be the motor for the esophagus and pharynx for swallowing, and larynx for voice, which is why when you're testing, you're checking for hoarseness. The spinal nucleus of trigeminal, which is sensation, and the meninges, or in auditory meatus.